This topic is for the ladies. We're talking about hot flashes, night sweats, weight gain. You don't have to suffer through perimenopause. Cleveland Clinic Dr. Rachel Novick is joining us to help. I appreciate you being here.
Thank you for having me.
I was just saying with her, I said, you know, women, we get almost fearful at the idea of going through menopause and what's to come and how is my body going to feel. But it starts with perimenopause. So what is the difference between perimenopause and menopause?
Right. So menopause is that 12 months when you haven't had a period. So it's this like backwards retrospective diagnosis where like, oh yeah, you haven't had a period in 12 months? You've been in menopause for the past year. Perimenopause is that whole transition period. So that can start 5 years, 7 years, 10 years, however long before, where you're just having symptoms.
That long before, even 10 years before.
So changes in your periods, heavier flow, lighter flow, shorter together cycles, longer apart cycles, you name it. But then the hot flashes, the night sweats, brain fog, fatigue.
I definitely get the night sweats. And it makes me feel better to hear, because I start thinking, is there something really wrong with my body? But that is a side effect. So what can we do as women during that even perimenopause period? Is there anything that we can do to kind of reduce symptoms and or calm our nerves about the whole process?
So I think education, like knowing what to expect. We're starting to talk about it more, but it's still growing, right? So learning what are the symptoms, what are the different options. So we have hormones, we have non-hormonal options, we have diet and exercise changes we can do. What are your triggers for some of these symptoms? Are they more focused around your periods? Are they worse right before your period? And kind of knowing how do we tailor your treatment to help you manage those symptoms.
So when women are in that state and they're getting into perimenopause, what are the things, you mentioned some of the signs to be looking out for. How do we help women get through the transition into menopause then too? And what should we be expecting once? I mean, you said before, no periods for a year, but are there other things that are going to be popping up as we hit that part of our life?
Right. So no periods for a year is that like traditional person, right? So there's other reasons you go into menopause. You have your ovaries removed from surgery. You had chemo or radiation therapy and you stopped getting a period. You're on a hormone blocker and you stopped getting your period. So there's other reasons why that can happen. But that like stereotypical person who goes from having a period to not having a period, that's the person that's like 12 months with no period. What are we looking for? How do we manage these things? There's a reason that birth control pills can be helpful. There's not always, the right solution for each person. So we have to figure out, is this the right thing for you? And we have to keep in mind, is contraception something we need to keep on board? Because as long as you're getting a period, you can still get pregnant.
Now, the hormone replacement therapy, that is something that I feel like was feared for so long, but it sounds like it is, new studies keep coming out on this, that it is beneficial, almost a necessity at times.
We have estrogen receptors literally everywhere. So our whole body is affected by lack of estrogen and these fluctuations. So the 2000 WHI study put this big fear into people, and now they've since redacted a lot of those warnings, a lot of those findings. We just had that black box removal removed from estrogen. So we're seeing that, like, yes, we do have this data. We know that it protects your heart. We know it protects your bones. We know it protects your symptoms and helps your brain fog and helps you get through your day and keep up your work life. All of those things that we still have to continue to do to live.
Well, and I know there's so many women out there who would be in the same position as me who have gone through some stage of a breast cancer diagnosis, and they were hormone positive and estrogen positive or progesterone positive. Would I be able to do hormone replacement therapy? And is there another alternative if you technically can't do it?
Right. So it depends, right? It depends on what the person wants. It depends on what medications you're on. It depends on the type of cancers. So if you have a hormone-sensitive cancer, it's a conversation of, is this, what are the risks? What are the benefits? When was your diagnosis? And are you still undergoing any sort of treatment? We have a bunch of great medications, mood medications like SSRIs, SNRIs, that can help with hot flashes and night sweats. We have 2 new medications that work on the brain signaling pathway called Veoza and Linquet. And those are saviors for some of our patients who can't be on hormones because they still help with the hot flashes, they still help with the sleep. And if you're sleeping better, if you're feeling better, all of a sudden some of that brain fog's lifted, some of your mood is improved. So it's not just one
one size
thing.
fits all. And again, what I'm learning from you is don't sit and just suffer through this. Go to the doctor. Have someone like Dr. Novick talk with you through these things, and know that like there is a specific plan probably for you versus maybe what would work for the next person. And so that is why we have them here to help us through this process.
Exactly.
I thank you so much. I could continue to talk to you for quite some time about this, and I know a lot of women are very interested in this topic,
Yeah.
so we might need to have you back to talk more if
Happily.
that's okay. Thank you so much for coming in today.
Thank you.